This is Gwekedu in Guinea, the epicenter of the Ebola epidemic that has killed more people in 7 months than all other Ebola outbreaks in almost 40 years. The World Health Organization and the United Nations are no longer downplaying projections. The rate of new cases keeps rising and the virus is gaining ground. This year's outbreak comes from the most dangerous strain. The Zaire strain was identified in the Democratic Republic of Congo, as it was known, in 1976. There are 5 Ebola strains, all but one originating in Africa. A person infected with it is not contagious during the incubation period, but that can vary between 2 and 21 days. Once the symptoms come out, it's virulently contagious, spread by contact with the patient's bodily fluids, saliva, sweat, feces, or semen. The people most at risk are family members and medical personnel. And although professional care practitioners take a series of precautions, they aren't fail-safe. Ordinary people caring for their own are perilously exposed and practically unprotectable, notably mothers with sick children. The greatest challenge for the health authorities remains rapid propagation.
The patients that are already in isolation will not remain under lock and key in the units to die. Some of them are strong enough to run, so they will leave the units to go home because they have to eat. And then when they go back home, it means that they will infect their community members, so we'll see more infections on the street.
We need to make sure that we can isolate enough cases to avoid more people than those that currently infected getting the infection. That will be the point where we can break the epidemic, and at that time we will be able to control it. But we are not there yet.
From 1976 to 2012, various outbreaks killed a total of just under 1,600 people. The number of cases declared in the current epidemic is some 9,000, of which some 4,500 have died. 5 to 7 out of every 10 cases ends in death. The spread is accelerating. Approximately there have been 1,000 cases developing per week. In the next 2 months, that's expected to rise to as many as 10,000 new cases per week. If the epidemic continues to rage in Africa, how to prevent contagion on the other continents and pay for it? The human and material costs for Europe and the United States, for example, are alarming, considering aspects such as screening procedures, quarantine, and the strain on medical resources, even keeping clean.